Dr. Joseph Ornato is this year's recipient of the Outstanding Contribution in Research Award. Dr. Ornato was nominated for the Outstanding Contribution in Research Award in recognition of a career spanning nearly 5 decades, defined by groundbreaking innovation and unparalleled impact on emergency medical research. A professor of emergency medicine and internal medicine cardiology at Virginia Commonwealth University Medical Center in Richmond, Virginia, Dr. Ornato also serves as an affiliate professor in the Department of Computer Science at the VCU College of Engineering. In addition, he is the medical director for the Richmond Ambulance Authority, Richmond Fire and EMS, and the Richmond Department of Emergency Communications. Widely regarded as one of the foundational figures in emergency medicine research, Dr. Ornato is ranked in the top 2% of researchers globally in the field and holds an H-index of 109, a rare achievement that reflects both the breadth and lasting influence of his work. His contributions have shaped nearly every aspect of emergency cardiac care, trauma, EMS systems, and critical care medicine. He co-chaired the NHLBI Resuscitation Outcomes Consortium, ROC, a collaborative network supported by over $50 million in federal funding. As chair of its Cataract Steering Committee, he helped design and oversee randomized cardiac arrest trials and have informed clinical guidelines and saved lives. Dr. Ornato's more than 400 published works trace the evolution of emergency cardiac care, from pre-hospital transport and CPR techniques to modern innovations like drone-assisted EMS delivery. He also served as editor of the journal Resuscitation for over 20 years, where he elevated the quality and rigor of research publications, mentoring countless investigators along the way. His research directly influenced the development and advancement of advanced cardiac life support, ACLS, establishing standardized protocol that empowered emergency teams to provide coordinated, efficient, and effective care. FACEP is proud to award this year's Outstanding Contribution in Research Award to Dr. Joseph Ornato.
I'm deeply honored to receive this award, which is especially meaningful to me as a life member of FACEP since 1979. My research career has focused on emergency cardiac care and resuscitation. Out-of-hospital cardiac arrest remains one of our most formidable public health challenges, claiming over 1/3 lives each year in the United States. But we're finally making real progress. When I began my career and directed my first paramedic program in New York City in the 1970s, survival in most major U.S. cities was less than 1%. Thanks to pre-hospital, emergency medical, and cardiovascular care advances, many more patients are now surviving and returning to meaningful lives. I know this not only as a clinician, EMS medical director, and researcher, but also as a survivor. In 2015, when I went into cardiac arrest in our trauma bay from a massive pulmonary embolism, I was saved by my emergency medicine faculty and residents who started CPR immediately, intubated me, gave me TPA and heparin, and got me on ECMO within 8 minutes of my collapse. 5 hours of open heart surgery to remove the clots in my lungs later, I was on my way to recovery. 6 weeks later, I was back at work full-time. As an academic specialist in cardiology and emergency medicine, I've been privileged to chair the steering committees of large, multi-center, pre-hospital cardiac arrest trials in the United States and Canada that bridge both disciplines, from our NIH-funded public access defibrillation study that provided the safety and efficacy data needed to make AEDs available to the public and required in all federal public buildings, airports, and commercial aircraft, to our Resuscitation Outcomes Consortium's groundbreaking clinical trials involving over 260 EMS agencies and 36,000 EMS providers running over 13,000 out-of-hospital cardiac arrests annually. ROC's 12 years of clinical trials gave us the data needed to optimize CPR techniques and clarify the role of antiarrhythmic therapy and circulatory adjuncts. Results from our studies helped shape the 2005, 10, 15, and 2020 American Heart Association and International Resuscitation Guidelines. Beyond the science, however, One of my greatest joys has been opening doors for fellow emergency physicians by appointing them to national leadership roles in the American Heart Association and National Institutes of Health committees and studies, ensuring that our specialties' voices continue to shape the future of resuscitation and emergency cardiac care. Today, despite our advances, the time to initial life-saving treatment after cardiac arrest onset remains our vicious enemy. My current American Heart Association funded research is in partnership with colleagues at Duke University and is implementing our nation's first FAA-approved drone-delivered AED programs. In closing, and on behalf of our future patients, I again sincerely thank our ACEP leaders for choosing me to receive this award and forever championing emergency medicine research. Together, we're changing the trajectory of resuscitation science and saving lives.